Hello, everyone. Welcome to our webinar. My name is Margie Beaudry, and I am with the Public Health Foundation, and we are thrilled to have you all with us today. I will say, just so everyone is aware, we are based in Washington, D.C. and the Maryland, Virginia, D.C. region, which is today having its first blizzard of the season right here at the beginning of the spring. As a result of this, we are all working remotely and doing this from our snowed-in homes. So we are sure that it's going to go beautifully, and despite the snow, we are here for you. But just wanted to make you all aware, if we have any glitches, that might be the reason. We're excited to have you all with us today. As we get started, I want to just share a little bit of housekeeping. All of the participants' lines are currently muted. Throughout the presentation, please feel free to use the questions panel to submit a question or a comment. We'll be taking questions at the end of the hour. And of course, if you have any technological issues, we can help you throughout. You can use the chat box to submit any concerns there. The slides for today's webinar are available for download in the handout section of your control panel. Feel free to download those at any time. We take a moment to tell you a little bit about the Public Health Foundation. We improve the public health and population health practice to support healthier communities. And we have been around for close to 50 years. The Public Health Foundation provides resources, training, and technical assistance to support your work in quality improvement, performance management, and workforce development. Many of these also link with Public Health Department accreditation preparation. For example, the Public Health Improvement Resource Center, the link is on your screen, is a repository of improvement-related resources that are organized by the 12 domains of accreditation and the 10 essential public health services. Also on our website, the Performance Management Toolkit, which includes resources and information about the Public Health Performance Management Framework and how it is implemented. This audience in particular may be interested in the work of the Council on Linkages between Academia and Public Health Practice and its draft of the Population Health Competencies. The Council is accepting comments on the draft competencies through the end of March this month, and we welcome your participation. Through the Train Learning Network, more than 1.5 million learners access online courses, archived webinars, live webinars, and curated training plans on both evergreen and hot topics. PHF also provides customized technical assistance and training to hospitals and health systems, health departments, and their community partners engaged in health improvement initiatives that address the upstream causes of health disparities, chronic and preventable diseases, and injuries. This includes programs like the one we're going to hear about in today's webinar. Before we get started, we have a few questions for you. We would like to understand who you are, what you're doing, and we'll help our presenters and us to tailor our comments to your needs. So our first poll is about to happen, and it's please tell us about your organization. I'd like you each to take a few moments, seconds, pick a choice, and we will look at the results in a moment. Okay.
Looks like we've got about 70%, I hope 72% people still voting. Okay, I'm going to close it.
Okay, and so here's who's on the line today. We have, sorry, I have to get back. My screen just won't let me see the results. But looks like the majority of those on the line today are from public health departments, and a healthy amount from nonprofit, community-based organizations, hospitals, health systems, and health centers, with a smattering of others. So we're glad to have you all here. I'm going to move on to the next poll. And this is if you could tell us about the partnerships that you're engaged with. Okay, Vanessa, are we doing all right?
Yep, we still have people voting. I'm hesitant to shut it down on them.
Okay, take another moment.
All right, looks like we've got about 70% again, so I'll close it.
Okay, and so it looks like close to half of this group either have a partnership program in progress or completed, or are have formed a coalition or partnership to move on something like that, which is wonderful to hear, that there's so much engagement in this kind of work. And for others of you that you're really just thinking about this or not really working on this yet, maybe this will be the inspiration for you. Okay. All right, so let me now, I can grab the screen. There we go. All right, so we're getting ready to start our conversation with our presenters. Today we are very, very fortunate to have with us 3 presenters from Minnesota. We have Dr. Rebecca Lindberg, who is the Director of Population Health and Professional Education at the Minneapolis Heart Institute Foundation. We have Cindy Winters, who's the manager of the Heart of New Ulm project, which we're going to be hearing about today, also at the Minnesota Heart Institute Foundation. And also joining us, Karen Moritz, who is the health official, the director of the Brown County Public Health Department in that town as well. So with that, I'm going to turn it over to Dr. Lindberg to kick off the webinar.
Well, good afternoon. Cindy, Karen, and I are really excited to be a part of the webinar today. Just a little bit of background about the organization that Cindy and I are a part of. We are from the Minneapolis Heart Institute Foundation, and our mission is to improve the cardiovascular health of individuals and communities through innovative research and education. And we've been in operation for 35 years. We're a non-profit organization, but primarily have been focused on clinical research and professional education with a little bit of community education until about 10 years ago when we ventured into the population health research arena. And that's the project we're going to be talking about today, our Hearts Beat Back Heart of New Ulm project. So over the next 40 minutes, we really want to walk through how our experience and what we've learned, and hopefully help you understand, how can you drive this type of community transformation by propelling health as a value across your community partnerships. We're going to be discussing a little bit about how to use data and how to leverage your data to engage those most at risk, but also about engaging your community and how do you use your data for influence across the community. And then we're going to talk about how we've created a sustainable network. So although this started as a 10-year research demonstration project, it really is a framework that will be sustained in the community moving forward, which we're really excited about. So New Ulm. New Ulm is a community that's 90 minutes southwest of the Minneapolis-St. Paul metropolitan area. Its population is about 13,000 people in the city limits. It's about 50% female and 50% male, and it's a really stable population, which was one of the reasons that it was an ideal community to have a project like this in and follow over 10 years because people weren't moving in and out of the community. The average age of the community is 40 years old, and adults account for about 70% of the population in New Ulm, and the population is about 97% Caucasian. New Ulm also identifies itself as the most German community in the United States. So we jokingly said that the 3 food groups when we went into the community were beer, brats, and butter. But in all actuality, it wasn't too far from the truth. So why did an organization like ours start thinking about population health and moving outside the clinic and the hospital walls? And I think we all know that 80% of health is influenced by things outside of the clinic and the hospital system. And this is a preventive cardiologist that works with our foundation, and he eloquently has said a healthy person over a given decade will spend about 2 hours with their doctor. And the idea that that 2 hours will determine their health for that decade is pretty unreasonable. So it's one of the reasons that over 10 years ago, another preventive cardiologist had this idea that what if we could intervene in an entire community, and not just in the healthcare system, but throughout the community. And he broached that idea with the health system, Allina Health at the time, and said New Ulm would be this ideal community because 90% of the population in New Ulm actually seeks care at the Allina Health New Ulm Medical Center. And that's where the partnership was established. The CEO of Allina Health at that time said this is a great idea. And at that point, they approached New Ulm, and New Ulm was at a great time in their community for this type of project as well. They were really excited about it because the city's leadership had just completed an offsite training retreat where they identified health as one of their top community priorities. So right after that, we approached them, and it was just this nice alignment of people coming around the table and being really committed to this type of work. So our partnerships are here. Minneapolis Heart Institute Foundation became the research arm of the project. We are also the fiscal arm and designed the intervention. New Ulm became our partner as the city. Allina Health New Ulm Medical Center became a natural partner given the work that they do in the community. And Brown County Public Health became a natural partner because of the work they were doing already out in the community. So our primary goal of the project is to reduce heart attack rates, but we do that through improvement in the modifiable risk factors for heart disease. And our target population are adults 40 to 79 years old that have an active Allina Health record and live in the zip code of 56073. When we initially went into the community, we did a community needs assessment using the electronic health record data, but also had community health screenings that help supplement that data. And we found that over 76% of the population were overweight or obese, 38% had metabolic syndrome, only 17% of the population were consuming the minimum recommendations for fruits and vegetables. Only 64% of the population were meeting minimum recommendations for physical activity. And there was a significant underutilization of preventive therapies such as aspirin, statins, or blood pressure medications among people at risk. So the electronic health record became our primary surveillance tool for this work because over 90% of New Ulm's population has an active electronic health record in the system. But we really had a more comprehensive data collection strategy that we have used over the 10 years that we've been working in the community. And that includes resident surveys. We do focus group testing on all our interventions, as well as kind of where we're at in the project and helping us define if we need to kind of take different directions, which Cindy and Karen will talk about as the presentation continues. We look at the environment, and we do environment assessments in the nutrition environment as well as with the physical environment, and then look at how we can influence policy and measure that change as well. As I mentioned, we supplement data, especially the behavioral data that's not found in the electronic health records, with community health screenings. And we also use national, state, local data when available and as applicable, and integrate all of this for assessment, monitoring, measurement, communication to the community, as well as influencing community change, all with hoping that this can help influence and improve health in the community. So are we seeing changes? We are in our final year of the research project. So we are doing, this year is a big evaluation year for us. But when we looked at our 5-year risk factors, we were seeing significant improvement of cholesterol at goal, triglycerides at goal, as well as better lipid medication usage. When we looked at behavioral data, we are seeing improvements in some behaviors such as physical activity, fruit and vegetable intake, and smoking rates. But again, you'll see there's definitely room for improvement. We didn't see much of a movement in BMI that has remained relatively stable over the course of the project, which some will define as being a success in and of itself. We also want to look at our outcomes, our 5-year outcomes, and compare them on a national level of what's happening. So we looked at the National Health and Nutrition Examination Survey data and compared it with a similar group, similar age from a similar time period, and have found that we have seen more improvement in New Ulm than we have nationally. This is a research or a project that's currently underway, and the paper is actually in press right now. But we looked at our data against a comparison community that falls within the same healthcare system, Allina Health. But it was a community where interventions weren't happening currently. But we did see that New Ulm, we were seeing better management of blood pressure, total cholesterol, and triglycerides. So we're hopeful that the work that we've been doing in the community, we are seeing positive health outcomes as a result of this work. But again, we will be doing a final evaluation and measurement later this year. So how did we intervene in the community? We really focused on 3 spheres of influence with our work: work sites, community, as well as healthcare. And we used the social ecological model as our framework because this is a preventive framework that considers the complex influences on overall health. So we know it's more than just the individual, that there's a lot of influences on our health. And we wanted to make sure that we were taking evidence-based interventions, talking to the community about whether these will work, how we modify them to meet the community's needs, but make sure that we're deploying these interventions at each of the different levels of the model all at one time. So just to give you an idea of some of the things that have been happening in New Ulm, targeted at individuals, we have a phone coaching program. We've provided provider education with CME training. We know that social connection is important to overall health, so tried to integrate social connection in the programs that we were doing, as well as providing networking opportunities to key stakeholders and business leaders. At an organizational level, we delivered interventions through the healthcare system, through our work sites. We also worked with the restaurants, grocery stores, convenience stores, and schools within the community. At the community level, we've had multiple partnerships throughout the community. We've put together events with our partners. We've designed 5Ks. We've had community health challenges, as well as multiple social marketing campaigns that have been deployed throughout the community. And as possible, we've been working to influence policy throughout the community. And Cindy will talk about, she's a regular at the city council meetings, but looking at ways that we can support and promote policy change at the local level. So I'm actually going to turn this over to Karen.
All right, hello everyone. I'm Karen Moritz, and I'm the local public health director for Brown County, which New Ulm is a city in our county. And I'm going to talk just a little bit about our structure and kind of how we work together to get all this work done. I first want to just say that it's been an honor to be involved in a project like this as a public health director. It's an opportunity that I never dreamed I would have, to have healthcare organization look at prevention, especially as far up as primary prevention, and actually try to implement them in the community that I'm a public health director in. So it's just been an honor. Just as you look at the slide, in the very beginning, MHIF and Allina were very interested in getting community involvement, and that was very important to all of us, that the community be involved. And we knew that in order to get this project off the ground and to keep it going, we'd have to have community buy-in. So they did develop a steering committee, and that's kind of representing on the ship there, a 36-member steering committee that represented about 17 organizations, and they met quarterly. They did give a lot of advice and input into some of the ideas and the activities and programs that MHIF and Allina were doing with the project. And it worked well. It seemed to go well, and it was helpful for everybody, and it did get some community engagement going. Here a few years ago, as the project was coming towards the 10-year research project ending, and knowing that this had gone very well and we were very interested in keeping it going and sustaining it, we looked at a different way of structuring maybe the project, so we could make sure that we moved it forward in a good fashion. So we switched it over. We, as you can see on the other side of the picture, we developed a leadership team. As we were structuring this or trying to look at structures, we did have the opportunity to apply and be accepted to the National Leadership Academy for the Public Health. And I'll talk about that just a little bit later. So that did help. That being a part of that helped us develop a new model of collaboration. One thing we really recommend is a sustainability strategy from the very beginning. I cannot stress that enough. Probably we didn't look at that at the beginning as we should have, and that's probably a lesson learned that I'm going to pass on to you if you haven't started or if you're just starting. Really think about how that's going to work and make that a strategy on your work plan and work on it all the time. We listed some of the things that we have done through that, and the last few years we've really worked hard on a sustainability strategy, and those are some of the things. I'm not going to read them to you. You'll have access to the slides, but measurable outcomes. I mean, we're still working on all of these as we move forward, but it's very important to look at sustainability. Oops, sorry. So as we moved forward to look at a different structure of how we maybe could sustain this in a good model, we came up with a 12-member leadership team. It represents 11 different organizations. There's 6 standing member organizations, the city, the schools, public health, Chamber of Commerce, the Medical Center, and the New Ulm Medical Center Foundation. We developed a vision, which is support a culture of wellness, and then we also developed a mission statement. The mission statement took a while to develop, but we got it done. When you have a lot of different minds coming together from different perspectives, that does present just a little bit of a different take on things. Of course, public health and the people involved in Heart of New Ulm think public health, they think prevention, but that is not how everyone on that group thinks. And so it's been a good learning curve and a lot of collaboration to get. The mission statement includes a statement that says that we would partnerships that empower people of all ages to take responsibility for their own health in a supportive environment. And sometimes public health tries to do those things to people, but this group was very collectively identified that we really need to help people with policy systems, environmental changes to be able to make those choices. Of course, as we go forward, trying to develop something sustainable, and I think the most important thing was we'd gone from 36 down to just 12 people, and how do we now get this back out into the community and get more community people involved? And because that's the way we felt that it could be sustainable. We did do a literature search, trying to find another organization that had the same project kind of going, and how are they structured. And while the literature search helped us, we didn't find anything exactly like us. So it was really hard to just kind of steal from somebody else. Or so we kind of came up with this on our own, and so far it's done a good job. So we developed 11 action teams. These action teams kind of represent some of our priorities that we're working on and strategies we're working on. There's 35 unique organizations involved and 83 unique individuals involved. The action teams are Safe Routes to School, Coalition for Safe and Active Streets, a Food Environment Action Team, Health Equity, Communications, New Home, which is another research project with the University of Minnesota, Worksite, Community Challenges, Mental Health, Fight Group, and Downtown Action Team. And these action teams are going to be fluid. They're going to come and go. And some of them are newer because we felt that it was a priority in a community health assessment that we did. For instance, the Mental Health Action Team is fairly new. So that's how we felt that maybe we could sustain this. And I think we've really gotten some leverage from this. The people that are on these action teams are very invested, and they work really hard. So I think it's been good. Again, just building capacity. It's just important that the community buys into this enough that they feel like they own it. And kind of the new motto is HONU is you, or Heart of New Ulm is you, because we want the people in the community to own this and to feel like that they've developed it, that they are part of this as we go forward now. In fact, I think it's been influential enough because the Ulm Medical Center Foundation has agreed to help us fundraise for money to support this as we go forward. We've really identified that being able to have staff to keep this project going is going to be necessary, and there's going to need to be funding beyond the research project funding that we've had. And so they've been very successful actually at fundraising, and I think that's because we have made this out in the community. Other things that we've done is we've been really intentional at understanding best practices. We've brought in some national experts to give presentations, conduct walk audits. We've also had regional experts, and we've sent community members to national and regional conferences so they can learn a little bit more, and looking at best practices and moving. For a while we were doing quite a bit of programming. That doesn't mean we're not going to do that anymore. The community likes to see that, but moving towards policy systems and environmental work to make the changes in our community. Just a little bit about the National Leadership Academy for the Public Health. This was a great opportunity. We applied. We were able to send 4 members of our leadership team, and you can see us there. This is quite a German community, and we're very proud of that, and we're able to take that to the maximum if we need to. In fact, I just had to tell you, one of our action teams, we're going to use sauerkraut in a billboard that we're creating around mental health and resiliency. So that's how German we are. But in 2015, this 4 members went to the NLAP, and it's a year-long training for cross-sector teams to learn various strategies to address population health and learn from each other. And we really had a lot of good experience learning about each other and how each other think. And then we had a coach that helped us through the period. And we were in this when we were developing our structure and trying to move forward towards sustainability as the research project would be coming to an end. So there we are, engaging. The Chamber of Commerce representative Audra is one of our strongest advocates and our strongest spokesperson now. And if you have a chance to look at the video, you'll see her, and she's quite entertaining. So I encourage you to do that. But she learned a lot about public health during this time with us, but we learned a lot from her too about how other people think, because we think public health. So she will tell you that you need to translate that public health language into business language, and she helps us do that. And you need to be teachable, and you need to think, when you're teachable, you need to think about what they're doing, what businesses and organizations in the community, what their challenges and their barriers are, and the celebration of victories that you have. So, and she also stresses that you don't pull the obligation card, that don't tell them you should care about this, because you need to work with what they do and how they think. And so it's been a great experience kind of trying to how to figure that out. And I think we've been successful. We have a pretty active worksite action team that engages a lot of different work sites, and I think we've been doing a good job with that, with her help. Another area that we ended up working out in the community is that, as Rebecca mentioned, MHIF has done a lot of focus groups and surveys and tried to understand what the community needs are. And one of the things that we've heard loud and clear is we need to involve the youth. And this is an adult research project, so we really hadn't branched out into that area. But certainly we heard them, and one of the first things we went towards was safe routes to school. It took a little time to get the city on board, but the school was all about it. And we got together and we got a Safe Routes to School planning grant from the Minnesota Department of Transportation, and it worked very hard. And that action team is still in process, making changes in our community to make it safer to bike and walk to school. You can also see the greenhouse there in the picture, and that was a focus that they wanted. They took that on. They're taking care of it. Of course, they've had some guidance and some help, and but they've got some of their own funding, and they've just really found that a priority. And I think that's because they've been involved with the Heart of New Ulm. We also have a bike trailer there, and there's been curriculum with the PE teachers. They can use bikes in their PE classes. We're working on healthier concessions. There's a school garden at the grade school, another champion that we have there that's really taken that on and taken that over with our guidance and a little bit of funding. And then our mental health action team is actually going to be starting to work with the high school with some of the work with adolescents and stress and increasing resiliency. Another area we get to work with is the government, and of course I work for the government, so I'm pretty in tune to that. But it sometimes can be a difficult hurdle. Some communities it's great, but others are a little bit more stressful, and we've had some challenges with that. But we've developed enough trust at this point, and we've found the right people to be on our leadership team. We learned all about how city engineers think, and trying to understand how they think, and I think we've done a good job with that. So. That took some patience, but it's been well worth it, and you'll talk about her regularity at this city council meeting. I just want to point out that, you know, we've heard from some communities that public health and healthcare working together can be challenging. It's their work and our work. I have never seen it that way, really. Maybe it's because I come from a hospital background as well, but my theory with public health is I don't have the resources or the capacity to do this on my own. And my job is to make sure it gets done. And as long as it gets done and gets done in a good fashion, I need to let whoever can do that, do that. I do want to emphasize that it's important for public health to get acknowledgement, though, and to be involved in the successes, because we are silent heroes and we need to be out there so people know who we are. Minnesota has a statewide health improvement partnership program that is called SHIP, that is state funding for policy systems and environmental work with the same goals as Heart of New Ulm. And we've been able to come in alongside of this project and work together. We have staff on 8 of the 11 action teams. One of the things we're real proud of, and MHIF has worked very hard, Cindy's worked very hard on this, is to get our restaurants in our community to participate. Over half of them do. It's a HONU designation of bronze, silver, and gold, depending on the health choices they have in their offerings. This particular restaurant owner was very skeptical at the beginning. She thought there's no way people would buy this. She would lose money, but she agreed to start slowly, and it has been extremely successful, to the point where the morning DJ on our local radio station the other day said they had an open house, because this Turner Hall restaurant did an open house, and he said, and they've got a lot of healthy choices if that's what you're looking for. So I was very proud to hear that he could even identify that they had a lot of healthy choices. The other area we've worked in is health equity. We've just really been able to identify that, of course, not everybody has access to the same things nationwide, and we've tried to be very direct about that. So we were able to pull some data from the electronic health record and identify some what we call hotspots in our community where there's a higher instance of chronic disease, and able to kind of focus on those groups. We were able to go into those communities called neighborhood gatherings and gather some data from some survey data, and provide some fun activities and learn a little bit about them. And we're hoping to start a strategy this summer with Park and Rec, the Park and Rec on the Go, that will go into lots of neighborhoods in New Ulm, but certainly target those areas where there's a little bit higher chronic disease. So I will turn this over to Cindy.
Thanks, Karen. So this is Cindy Winters, and I'm the project manager for the Heart of New Ulm project. I do work for MHIF, but I am located in the hospital at Ulm Medical Center in New Ulm. And as both Rebecca and Karen mentioned, we started out really heavily with programming with this project, and it was mainly to get the community involved and engaged in the project and get them to try and understand what we're trying to do. And we've slowly shifted to systems and environmental change and policy as well. And this is just a chart of some of the changes that we've been able to make since we started making that shift. And we started making that shift in 2012 when really thinking about the sustainability of the project, because New Ulm had put in a lot of, the residents and the community had put in a lot of time and effort and energy, and they wanted to see it sustained. They didn't want to see it end after 10 years. And so policy, systems, environmental change are really the way to sustain the work. And we'll pair programming on top of that to support those policies that we put into place so people really understand the importance and the need for further policy implementation. But one of the things that I personally, I guess, am most proud of is the Complete Streets policy. The city adopted it in 2016, and it took 4 years to get that in place. As Rebecca and Karen have both mentioned, I'm kind of a government nerd, and I go to all the city council meetings, whether there's anything on the agenda for the Heart of New Ulm project or not, because I think it's really important to understand how the city councilors are thinking and to listen to the conversation so that when we do have something on their agenda, I know how to frame it up for them so that they better understand what it is that we're trying to accomplish and to help lay the groundwork for further work that we're trying to do. This is just an example of one of the real quick wins that we were able to have after we brought in a national transportation consultant to do a walk audit and report for the community. Mark Fenton came in, and we had an opportunity to improve access on this particular street that's located across the schools on one side of the street and the recreation center is on the other side. Karen's public health department is on the same side of the street as the schools. And this street was not easy to cross. It was nearly impossible to cross. You've heard Minnesota nice. Well, they kind of forget about that part when they're in their cars and driving. They don't stop for pedestrians. So we had the opportunity to implement this mid-block crossing, and it has been very, very successful and really was an early win for us around policy work. And people really understood why it was important to start looking at the environment and how they could make changes to the environment to make it safer so that people would walk and bike more often. And then this is just a continuation of the chart of the additional things that we've been able to accomplish. When the project started in 2009, the Heart of New Ulm project did offer runs. And now in 2017, there are 8 runs a year, and Heart of New Ulm does none of the runs anymore. So a lot of these programs and opportunities have been embedded within the community organizations that sit around the table and that partner with us, and through the action teams as well. So we've been able to incorporate and put in 9 pieces of fitness equipment in 3 different parks. We do have a Safe Routes to School program. We really, because there was such a desire by the community to address children, when you look at the built environment, when you make changes that meet the needs of children, you're also meeting the needs of your target population. So it was an easy fit for us, and it really helped to move some of the initiatives forward because people wanted to see their children be safe in the community. And then we just recently received a bronze level designation for the bicycle friendly community. And we have, so this is just a picture of the outdoor fitness equipment that we have in the 3 different parks. We also have a walking trail, a bike trail that goes around the community, but in the wintertime, the city was not clearing it of snow. And so we empowered the residents to reach out to the city council, and they put together a petition and were able to have the city council agree to clear the trail of snow in the wintertime. And so that trail gets used year round now. And a conversation that we just had last night at the city council meeting was they didn't feel like they needed sidewalks in a particular neighborhood because people don't walk in the wintertime. And then they were reminded of the fact that, oh yeah, we have to clear the bike trail in the wintertime now because people asked for walking trails. So they're starting to figure it out. It's slow, but it takes time. One of our primary strategies has always been community communications. It's been one of the keys, and it was a strategy that was highlighted by the developers of the North Karelia project as a must-have in order to be successful. So we have worked really hard to market a way of life with messages that penetrate the entire community. We're helping to propel a shift to a culture where health is the new norm. And creating a culture change to improve residents' health is a marathon and not a sprint. So a comprehensive long-term communication strategy is necessary to help infiltrate the community. And we strive to have messages everywhere that a person lives, works, or plays, so they hear the same message throughout their day. And as a result of our communication strategy, we've been very successful in project awareness. After the first year of the project, we were able to, we gained a 94% name and branding recognition in Ulm, and we've actually maintained a 90+ level of recognition throughout the entire project. And we work really hard to get communications out into the community at least 2 times a month, if not more. We have a Facebook page, a website. We do an e-newsletter that comes out monthly that reaches 2,700 people. We do all sorts of different strategies for communications. And funding is always a big question and concern. We have maintained a diverse funding stream throughout the project, mainly through the Allina Health system was our primary funder. We've also applied for various grants and received funding through philanthropy. As Karen mentioned, the Ulm Medical Center Foundation has agreed to fund us for the next 3 years after the research portion ends. And we're continuing to work on identifying what that long-term sustainable funding model is. We've researched other models. It's comforting to know that no one's figured it out, but it's scary that no one's figured it out. So we're working on trying to identify what that looks like for our coalition here in Ulm. And I think now we're going to switch over to do some polls.
Yep, thank you, Cindy. So we have 2 more poll questions, and then we're going to go back to you. So for those of you who are in partnerships or have been in partnerships, this poll question is for you about the health of your partnership. So what is the status of your partnership? And for those of you who are not in a partnership, go ahead and indicate that as well. Okay, Vanessa, how are we doing?
A lot of votes coming in. I'll give folks just another second. All right, I'm going to close it.
All right. Wow. So we're seeing, a lot of good things happening. But some of you can see that there may be some challenges. About 40% of you say that what you're doing could be going better, could be improved. So let me ask you then to focus on that for our next poll is what is it that is getting in the way for those of you who are having those kinds of challenges? You only get to pick one. So sorry about that.
Looks like people are thinking a little bit more on this one.
Well, and this might not apply to as many, right? We only had 41% who said that they were having challenges. So we may not hear from everybody this time.
All right, I'm going to close it. Here we go.
Okay, so as we were hearing from Cindy, funding is a challenge, the biggest one in this set, and the time issue as well. It's interesting about the alignment piece. I'll be interested to hear more about that from some of you perhaps in the questions and answers or beyond. So, all right, let's continue on then with Cindy.
Okay, thank you. So, sorry. Well, I'm just going to wrap up with the lessons that we've learned through the Heart of New Ulm project, and that it's really important to understand the health needs and the readiness for change in your community. You really need to have a strong understanding of your community, and don't be afraid to ask questions that you already think you may know the answer to, because a lot of times you may not really know that answer. You want to engage key stakeholders around a common agenda. You need to learn to speak their language. What motivates them? Health is not necessarily a motivating factor, and Audrey will tell you that for a lot of businesses, and she's not afraid to let us know that that's not what motivates. It's the economic development piece. It's the employee it's the employee productivity and those kind of things, and we have to learn to speak in their language. And we get called on it a lot, and I really appreciate that she's willing to do that. Leveraging community resources will really help advance the agenda more effectively and efficiently. In the beginning, we were doing a lot of duplicate services with organizations that were already doing similar things. And I think that really kind of sends the wrong message to your community. So learning how to leverage those resources is really important. Realizing that communications is a key strategy throughout the process. Don't try and get so many messages out there that you're confusing the issue. Build community capacity. Sit back and look and see what your community really needs to know and to understand, and bring in national experts, regional experts. Send them to conferences. Let them experience and see what other people are doing across the country. Don't always be the one that goes to the conference and brings the information back, because that personal experience is so valuable. We sent a city councilor to the National Pro-Op, Pro-Bike, Place conference a couple years ago, and she just came back all fired up and excited and went and started talking to groups, and it was just the best thing that we could have done, our best investment. As Karen mentioned, really think about sustainability from the start. It'll help you design a stronger program in the very beginning than to think about it midway as we did, and realize that this is a marathon. It's not a sprint, and you really need to celebrate successes, which is unfortunately something that I'm not really good at doing. I really try and let others do that. And one of my favorite quotes is really, don't judge each day by the harvest that you reap, but by the seeds that you plant. Because when you hear community members saying to other people things that you have said to them, then you know that you're making progress and that they're starting to get it. And another one of my favorite quotes is, just as ripples spread out when a single pebble is dropped into the water, the actions of individuals can have far-reaching effects. And this is our contact information, and I just want to remind you that there is a link on this contact page to a documentary that was developed for the Heart of New Ulm project in 2016. It's 20 minutes long. It's really well done. It'll really give you a good overview of what the all-encompassing project that it is. And I think now we're ready for questions and answers.
So thank you, Cindy. Thank you, Rebecca. Thank you, Karen. What a wonderful program, and thank you for sharing it with us. We are going to queue up now questions and answers. There are already some questions in the queue. Those of you who have been scrubbing your heads and thinking about how many of my questions can I type in, go ahead and start typing. As you're doing that, let me tell you a little bit about PHF's response to this. The Public Health Foundation helps organizations to improve health outcomes and lead change initiatives, very much like this one. PHF experts have helped more than 500 organizations to solve health improvement and performance problems. We've created customized population health solutions for health departments, hospitals and health systems, and their community partners. And we tailor this assistance to accelerate change and innovation in support of your priorities and your community's needs. So I encourage you, if you are thinking about building a partnership, if you're in a partnership that may be struggling and could use some help, please don't hesitate to reach out to us. We'd love to be of support and help to you. And now, yes, we're going to move on to a question. So if you haven't already, please type your question into the questions panel. We are going to get to as many of your questions as we can while we still have time here live, but we will create answers to all the submitted questions, and we will make them available online in a few days, just following the webinar. So, Vanessa, do you want to get us started with the Q&A?
Yes, thank you, Margie. And what an amazing presentation, which I think is why we have so many questions already. And a few about funding, if we can start there. I think not surprising considering the poll. So if you guys could just talk a little bit more about your funding sources, and that would be great.
So initially we had grant money from Allina Health. So that was an arrangement made by our preventive cardiologist whose vision this project was. But we've supplemented that by, after setting strategy for the project and knowing where we want to go and what we want to do in New Ulm and working with the community to set that strategy, we look for grant opportunities to do that. So we have had a USDA grant, we've had a CDC grant opportunities. Cindy's mentioned some of the training opportunities. A lot of those were grant opportunities that our team and people in the community were able to take part in because we brought in financial arrangements. We also have moved over the last couple of years to a philanthropic approach through both our Minneapolis Heart Institute Foundation as well as the New Ulm Medical Center Foundation. So we've both dedicated money from our galas that have gone to the project. They have a golf tournament and money has gone to the project. We have had private donors that are very interested in prevention. So they've contributed to the project. So it's been a mix.
Excellent, thank you. That's very helpful. We did have a couple of questions about funding. So at the beginning of the conversation, you were talking about electronic health records, and someone was wondering how you're working around HIPAA and confidentiality. Did you obtain consents from each of your individuals for your intervention?
Yeah, 80% of the population in New Ulm has approved us using their information, and then we do, follow all HIPAA guidelines, and all our projects and everything go through IRB as a research project. So regulated that way as well. But we're lucky. We came out in the community as a research project, and we have had very high success in people working with us to, no matter whether it's the electronic health record or submitting surveys or answering questions to surveys, people are more than happy to be a part of that. They feel like this project has been a gift to them, and they feel like they're making a difference not only in their own community, but they know that we're using what we're learning in New Ulm to disseminate and share with other communities, and they feel excited about that opportunity to participate that way too.
That's excellent. Thank you so much. We had another question regarding the discussion about community communication. They're wondering what the most successful forms of community communication have been, and maybe where you've seen the most reach.
That's an interest. Oh, go ahead, Cindy.
I was going to say, yeah, we've tried to do all different types of communication, and whenever we have an event or anything, we ask people where they hear about the message. So we've used the newspaper because there is a lot of people in New Ulm still purchase the hard copy of the paper, and it's also available online. Our newsletter is very popular. We tried to do Twitter in New Ulm, but people in New Ulm don't tweet, so we don't use that anymore. We do use Facebook. And we do an annual report back to the community on what's been happening over the course of the year, and we highlight different things that we've been able to accomplish and let the residents know the changes that have been made in the community, and as far as the health has it improving. We use fact sheets. We create fact sheets for specific audiences on different topics related to what we want the message to be for that particular audience at that time. Rebecca, you want to go talk about it more?
Well, the only thing I'd add to that is I think more than one channel being better than the other, it's about that we've done it throughout the community and been very strategic about it. So the messages that people might see in their paper, they see in their restaurant, or they see in their work site. The message they might read in the newsletter are also messages that they're hearing on the radio or via cable access. So we're trying to be really strategic about how we message, and then we do message testing with the community too to understand what type of messages appeal to them most and how we should position our messages to be appealing to them and how they want to receive information. So we're constantly getting their input on it as well, but I do think it's more about we're kind of blanketing the community, and that's what's making the communications strategy successful.
Oh, excellent. So that repetition, that's great.
Yeah,
we had a few questions about communications as well and community engagement. We had a question specifically about your health equity discussion. You talked about finding hot spots in the community. Could you tell us a little bit more about that and what you used to find those hot spots?
This is Karen, and we're very fortunate to be able to use the electronic health record to help identify that. So, of course, the electronic health record knows addresses and knows diagnostic codes, and so able to identify. We picked a few chronic disease diagnostic codes, and then we were able to identify on a map, actually with mapping, where those areas are that have the highest areas of those diagnoses. We also have a very talented individual that works at Ulm Medical Center that helps us with that. And then MHIF has a very deep area of expertise and data analysis. So that's how we did that. It's been very useful.
Excellent. We had another question on data in the community. Do you utilize health information exchange to gather data?
This is Karen again. I can probably answer that. Health Information Exchange has not matured to its full capacity yet in Minnesota in general. We're still just working on that. There is some direct secure messaging that occurs between facilities, and of course, large organizations such as Allina have complete exchange throughout their own system. But to exchange health information, as I think that's what, as they're referring to it, like through a CCD method or things like that, that isn't quite mature in Minnesota yet. It's being developed, and our vendors are coming and going that are doing that.
Excellent. Thank you. Perfect. Then we had one specific question about the walk audit that you talked about. They said, my department has had a hard time finding a walk audit assessment tool that works for our landscape, Phoenix, Arizona, in the desert. I'm always interested to see what assessment tools other departments use for walk audits.
That's a really good question. Actually, I think it's our experience was if you bring in the right person or have the right person leading the walk audit, someone that's really passionate about the environment, and it's more about how you feel when you're walking in an area, not necessarily, is your sidewalk wide enough? Is it in good repair? It's more about, do you feel comfortable and safe in that environment? And what is it about that environment that is preventing you from feeling comfortable and safe? Why do you avoid a particular area, or why don't you cross an intersection? And a lot of times it's because the amount of traffic, the speed of traffic. So it's not necessarily always about the tool, but how you frame it up. Does that make sense?
Yeah, that makes a lot of sense. And did you also use a consultant for that?
We did.
an
We
expert.
got Mark Fenton in, and if anybody's ever had the opportunity to work with him, I always describe him as the ever-ready bunny on steroids. He is phenomenal and super motivating, and he will get your community excited about making change.
Well, that's great.
Well,
Thank you so much.
It looks like we're right at the top of the hour, I know that there are many other questions in the queue, but we aren't going to have time to take them live. We will, as I said earlier, make sure to post on our website the questions and answers from this webinar, the ones you've heard and the ones you haven't. And we will also be sharing via email a link to the archive of this webinar and the contact information for our presenters, which is also in the slides, which you can download in the handout section of your panel if you haven't already. I want to thank all of you for joining us. We've had, boy, what a inspiring story, and we're very energized. I know I'm going to go out and shovel some snow and get my heart going, and we'll look forward to hearing your feedback. Thank you so much.